Some of you know that I see patients every Tuesday at the University of Maryland Medical Center. Leah was a 27-week preemie, very premature, born with serious feeding challenges. And to this day, and she's 6, she has tremendous difficulty eating enough to maintain her weight. So about half of her calories come from meals and nutritional supplements that she can take by mouth. And the other half comes from feeding tube administered feedings. Earlier this year, the family's insurer notified us that this tube feeding, which again is supplying half of her needed calories, won't be covered any longer. In these past 6 months, Leah lost 1 pound. She's a 6-year-old. She should have gained 3. She's falling and falling. Sure as heck, I think, we'll probably have to admit Leah to the hospital for more intensive care to get her nutrition repaired. It's a huge expense, and it's an avoidable expense.
I was in clinic on Friday on Veterans Day, and I saw a patient, a woman in her 40s, who told me that the ACA allowed her to get her life back on track. Just 2 years ago, this woman was homeless, and she was going in and out of ERs every week. Because of the ACA, she got health insurance. She got her diabetes treated. She got her blood pressure under control. She was diagnosed with depression and alcoholism, and she got into treatment for her mental condition and also for substance use addiction. And as a result, she got her life back. She got a job. She has a home. She's taking care of her kids. Health insurance, she told me, is her rock.
As important as healthcare is to everyone, the costs are rising. Who can help us bring down that cost? These individuals. And that's why it's so important that we understand the significance of getting young folks engaged, enrolled, and in our healthcare exchange system, because they're the ones that will help us in the long run. We know of the many conditions facing our communities throughout Baltimore, throughout our state, throughout our nation. We know that cancer rates are high. We know that diabetes are high. But this is not just about the diseases that people are infected by every day. This is about how do we prevent these diseases and how do we lower our costs.
Senator Elizabeth Warren asked me to come and talk to her staff, and they asked me the question, Mayor, so what is the most important thing you've done in your 20 years of being in Congress? And I told them voting for the Affordable Care Act. And they said, why? I said, because I know that I'm saving lives. I know that I'm making it easier for some family not to go into bankruptcy. And I know, and when I think it was you, Doc, that was talking about Leah. Who was talking about Leah? You were talking about Leah. I can relate to everything you were saying. You know why? About the feeding tube and all that. Because my mother had a stroke on the first of the year, and we fortunately, John, I got 6 brothers and sisters, and we're able to share the responsibility. But I don't know what we would do if it wasn't for something like Medicare. I really don't. I mean, even with Medicare, and I know that's a little different subject, but I'm just telling you, I can see how a family with one incident can go bankrupt.
20 million more Americans have health care coverage than they did 5 years ago. We've reduced the uninsured rate to its lowest rate in history of our country. So as Elijah Cummings was saying, we don't want to throw that out. We don't want to go back to the beginning. We need to strengthen it. We need to make it work better. We need to lift up more Americans and provide broader coverage. And we can do that if we have the kind of rational conversation in Washington about where our healthcare system is going that I know Elijah and I and other members of the Maryland delegation are going to reach out and hope to have with our colleagues.
Still, to this day, over 2/3 of the remaining uninsured don't know that this financial aid is available to them. So this message is critical. We have a lot of work in front of us. We are very happy to have the help of the folks in the room to help us get that message out. And we're excited to roll up our sleeves and get to work.
Dear Health Exchange, my experience today has been wonderful. Thank you for helping my family, my boys, Noah and Nolan, their big sister Noni, my husband Twain, me. We are so grateful. This, y'all, is the story of a family that coughs and bleeds and slips up and falls, but we get up covered. This is the part of the poem I like. We sleep all night covered. Y'all say covered. We work, we school. We eat, we argue, we love. We're covered, y'all. We are covered. We're covered like snow on the sidewalk. We walk like covered people. We talk like we are protected. We are safe. We are sound. This is the story of a family resting assured. Peekaboo. We're good. Woohoo! How good you would feel if you were covered too.